Welcome to the National Nurse Aid Assessment Skills Review. We will spend the next hour reviewing each of the skills tested during the Nurse Aid clinical exam. I will provide you with information on scoring and instruction provided to the candidates. Please note this presentation covers all 23 skills available in the National Nurse Aid exam. Your state may not test all of the included skills. Please refer to your state candidate handbook for the skills that are tested in your state. To ensure a valid assessment of competency as a nurse aide, the National Nurse Aid Assessment Program examination has been designed to determine whether a nurse aide candidate has the knowledge and skills required of an entry-level nurse aide. Whether the nurse aide candidate possesses the required knowledge and skills to perform these tasks is determined through the written or oral examination and the skills evaluation. The focus for this presentation will be on the skills evaluation. The skills evaluation is a test of the candidate's ability to perform a set of tasks routinely completed by a certified entry-level nurse aide. The skills evaluation is administered in a setting that is as similar as possible to one in which nurse aides actually work. A candidate volunteer plays the role of the client or patient. Each candidate is presented with an exam form containing 5 skills, which the candidate will be asked to perform within 30 minutes. Each skill is broken down into its essential steps and can include an important critical element step highlighted in bold type on the candidate's skill listing. If a critical element bolded step is not completed correctly, the candidate fails the skill and the skills evaluation. The RN evaluator observes the candidate performing each skill and documents whether the candidate has performed each step correctly by marking a yes or a no on the answer sheet. In each skill, the candidate must correctly perform all critical element steps and correctly perform a specific number of steps overall in order to pass the skills evaluation. The candidate handbook provides detailed information on the exam day and the skills tested in your state, along with the skill steps that each candidate is graded on. Each exam form contains 5 skills. All exam forms start with hand hygiene as the first skill tested, and all exam forms contain one of the measurement skills: blood pressure, radial pulse, respirations, urine output or weight. Each measurement skill requires that the candidate write their measurement on the measurement sheet so that it becomes part of the exam record. Some skills are performed on the candidate volunteer, playing the role of the client. Some are performed on the mannequin, and others without a client or patient. For example, measures and records urinary output and denture care. The skills are performed in a mock clinical setting using real water, real supplies, and steps are to be completed as written. The candidate handbook for your state lists the skills tested and the steps to be performed. Candidates must pass all 5 skills in order to pass the skills evaluation. At the beginning of each skill, the evaluator will confirm that the candidate is ready to begin. And at the end of each skill, the evaluator will confirm the candidate is completed and ready to move to the next skill. During a skill, a candidate can correct mistakes by telling the evaluator they have made an error, what it was, and what they would like to correct. Some steps cannot be corrected, such as putting on or removing gloves. Depending on the step or task missed, the evaluator might ask the candidate to perform the step again. If the candidate performs the step in the correct way, the evaluator will score yes on the step. Note that once the candidate is completed with a skill and confirms they are moving to the next skill, they cannot go back and make a correction. The correction must be completed during the current skill. The communication between the evaluator and the candidate is very important. In order to provide a consistent testing experience, Evaluators are required to use the following responses. If the candidate asks a question about the test content, the evaluator will say, "Do what you think is best." If the candidate is only verbalizing or simulating a step, the evaluator will say, "In order to receive credit, you must actually do the skill or step." If the candidate wishes to correct a step, the evaluator would say, "Tell me the steps you wish to correct and when you would have done them." And once the candidate replies, if applicable, the evaluator will say, "Please do the step or steps." If the candidate indicates that they are finished with the exam, but the evaluator realizes that they have forgotten to perform a skill, the evaluator will say to the candidate, "You have not performed the skill," and then give them the name of the skill. "Please perform it now." Additionally, if the candidate asks the evaluator, "Can you tell me if I passed?" or "Tell me about my performance?" the evaluator will always say, "I am sorry, but as a nurse aid evaluator, I'm not allowed to answer questions about your evaluation results. Your score report will provide you with the information you need for your skill step performance." Please note, the evaluator will not share testing information with the candidate, instructors, or faculty. The evaluator's role is to objectively observe the candidate performance and mark yes if the candidate performed the step as written, or no if they did not. There are steps that have common content across all skills and are worth spending some time mentioning, as these are often missed by the candidates and are well defined within the skill steps. Here are a few. Safety. When you are working with the patient, the client, for example, in a skill where you need to stand the client up, are the client's shoes on? Are the client's feet flat on the floor? If you're using the wheelchair, have you locked the wheelchair wheels before the client is stood up? For water skills, have you checked the temperature of the water for safety? Have you asked the client to check the temperature of the water for safety? Are you using proper infection control and following the skill steps for when to use a clean washcloth or when to use the clean side of a used washcloth, and when and how to dispose of used linen and to empty, rinse, dry, and properly placed equipment in the labeled dirty designated supply area? Is the bed at a safe level for the client? Does the client have the signal device? Who? Have you introduced yourself to the client? Have you explained the procedure? Before feeding the client, did you look at the name on the name card and ask the client to state their name? Privacy. Did you pull the privacy curtain? Have you made sure the client is not overexposed? Where? Where should you be performing the skill? Where is the client? What should their position be during the skill? Supine, high fallers, other? If you read the skill steps carefully, you will notice that these questions are answered within the skill steps. There are many order words written into the skill steps. It may be helpful to read through the skill steps in the candidate handbook and circle these order words. After. After is often seen in the context of after completing a skill, washes hands. This step is repeated in multiple skills and sometimes connected with gloving and always before recording a measurement. Before. Before is another word that is seen in multiple skills, such as in the positions on side skill. Before turning lowers the head of the bed, or in ambulation and transfer and other skills. Before assisting to stand checks or locks the bed wheels. Before assisting to stand, client's feet are flat on the floor. or in water skills. Before washing, check water temperature. Have client check water temperature. Beginning. This order word tells the candidate what to do first. For example, beginning with eyes, washes eyes with wet washcloth, no soap. While. Two actions are required within a step. For example, while supporting the foot and ankle close to the bed, pushes and pulls. Or, while holding the catheter at the meatus, cleans 4 inches of the catheter. In addition to order words, the skill steps contain communication prompts, such as explain procedure, speaking clearly. Ask client to step onto the center of the scale. Ask which shirt they want to wear. Ask client what he or she would like to eat first. Tell client what food and beverages are on the tray. There are also words that provide direction on amount, such as all, lathers all surfaces of wrist, hands, and fingers. I also recommend you read through the water skills and circle the words clean. There's a clean washcloth and clean area of a washcloth. We will take a closer look at this when we cover the skills in detail. A clean washcloth is a brand new, not yet used washcloth. A clean area of a washcloth is a washcloth that may already have been used, but the candidate uses a different clean area for each stroke. And most importantly, the best way to help candidates succeed is to make sure that they understand the why they're performing the skill and step and the how the skill step is to be performed based on best practice. The first skill is always hand hygiene, and for many reasons, this is one of the most important skills. Candidates often rush through this skill, possibly nerves, or simply they are not as concerned with the skill. After all, it's just hand washing. We do that all the time. Note this skill has a component of time in it, 20 seconds. Step 5. Lathers all surfaces of the wrist, hands, and fingers, producing friction for at least 20 seconds, keeping hands lower than elbows and fingertips down. The evaluator is timing the 20 seconds. So should the candidate. Before the skill begins, the evaluator will ask the candidate to remove watches and/or bracelets for the duration of the hand hygiene skill. If they cannot be removed, the evaluator will not penalize the candidate that washes up to, over, or around jewelry. But wearing a lot of jewelry on the wrist may make this skill challenging for the candidate. So wear just a watch with a second hand. Take it off before the skill begins. Place it on the sink where you can see it and use it to time your 20 seconds. The candidate must produce lather. Remind candidates that wet hands and wrists comes before apply soap to hands. And do not lather under the running water. It is very hard to create a lather when the water is rushing over your hands. Let the faucet run. Pull your hands back a little away from the water and lather. Do not forget step 6, the fingernails. And step 7, rinse completely. Note how the paper towels are used, at least one for the hands and a different one to turn off the faucet. Start your drying at the fingertips. A candidate who rushes through this skill could possibly fail the exam in the first 5 minutes. Take a deep breath, focus, and move through this skill mindfully. 1 knee-high elastic stocking. This skill is all about the start. After completing steps 1 through 3, the candidate must prepare the stocking correctly in step 4 in order to be off to the best possible start. Step 4 must be completed in order to correctly complete steps 5 and 6. Step 4. Candidate needs to place their hand and their arm into the stocking. Pinch the heel. Candidate should pull the top of the stocking down their arm as they hold onto the heel. This will result in the top of the stocking being inside out and over the candidate's hand. The candidate must then pull the stocking off of their arm, keeping it inside out, and it's best to keep the heel down. Step 4 now complete. Next, candidates should use their hands to stretch the foot of the stocking open, and then slide the foot of the stocking over the client's toes, foot, and heel in one smooth motion in step 5. Step 6, pull the folded top of the stocking over the already covered heel and then up the client leg. If step 4 is skipped and the candidate rolls the stocking down instead of turning it inside out, the candidate will not be able to complete the rest of the steps correctly, and the candidate will struggle to get the stocking onto the client. So remember, the start is very important. The finish is equally as important, specifically step 8, which is our bolded step. Admire your work once the stocking is in place, and then look carefully. Is it wrinkle and twist free? Are the heel and the toe in the correct place? If it is not, fix it before the end of your skill. Many of the skills involving the client standing, like this one, assist to ambulate, require some key steps to be completed. For example, put shoes on the client. Note these are the candidate volunteer's own shoes. In this skill, the bed must be at a safe level so that the client can sit on the side of the bed with feet flat on the floor. The candidate should assist the client to sit on the side of the bed. Note, assist means to touch the client, to assist them to sit up. Feet flat on the floor, candidate must make sure that before they actively stand the client up, the client has both of their feet planted flat on the floor. Knee to knee and or toe to toe, which means the candidate's knees or knee are touching the client's knees or knee, and or the toe of the candidate's shoe is touching the toe of the client's shoe to maintain stability. Note, beginning with step 3, all of the steps start with the order word before. Steps 3 through 8 are all conducted before the client is assisted to stand up. Pay attention to the words securely, prearranged signal, stability, assists, slightly behind. Note the hand position on the gait belt in step 10. It's an upward grasp. This skill provides very detailed instruction for the candidate to follow, all of which are focused on the safety of the client. Assist with bedpan. Pay attention to the bed position in this skill. The position of the bed is mentioned in step 3, where the candidate must lower the head of the bed before placing the bedpan. Take a look at step 7, where the candidate must raise the head of the bed after the bedpan is positioned. And step 12, head of bed lowered before bedpan removed. And then finally, step 17, bed in low position. Pay attention to when to put on and take off gloves, which is very important within this skill. The candidate is allowed to gather all supplies, including the bedpan, without their gloves on. But before the candidate picks up the bedpan to place it correctly under the client, step 4, the candidate must have gloves on. Look at steps 6 and 7. The candidate must remove gloves and verbalize, wash hands, after placing the bedpan under the client and before raising the head of the bed. Step 11. A new pair of clean gloves must be put on before removing the bedpan. Step 16. The gloves are removed and the candidate verbalizes they would wash their hands. We often consider the PPE skill as a place to focus on gloving, especially how to take the gloves off correctly. Skills like bedpan, denture care, catheter care, pericare, And all other skills that have gloving written into the steps require that the candidate wear the gloves at the correct time and correctly remove the gloves without contaminating themselves. Clean's upper or lower denture is performed at the sink side. Step 3. What is moderate water temperature? And more importantly, how is it scored? Moderate water temperature is determined by if the faucet has a single handle, the candidate should use center setting. If it has one handle for hot and one for cold, both should be turned on. The evaluator does not touch or test the water. A bath thermometer is not used. This skill does not use many order words, so the second most asked question in this skill is what needs to be done first, second, and so forth. Some steps have a logical order. For example, you must put on the gloves before handling the denture. You must rinse the denture with water before brushing. You must apply toothpaste to the denture toothbrush before brushing the denture, and so forth. But what about step 7, rinsing the cup and the lid? Can that be done first before rinsing or brushing the denture? Yes, it can. The only order requirement of step 7 is that it is completed before the denture is placed back into the denture cup, which makes sense. What is clean technique as mentioned in step 10, and how is it scored? This step pertains to the handling of the denture and toothbrush throughout the skill. The candidate may lay a barrier down on which to place the clean denture and toothbrush while they are rinsing the cup and lid, or they may hold the denture in hand until ready to place it in the clean cup. A barrier can be a washcloth, a towel, or a paper towel. Counts and records radial pulse. Here's another skill where the candidate can use their analog watch, a watch with a sweeping second hand. I always point out here that it is very important the candidate know how to use the analog watch and how to determine when 1 minute is up as scored in step 3. The evaluator will ask the candidate to tell them when they're beginning the minute and when they were ending the minute, so that the evaluator can score step 3 correctly and take pulse in the opposite wrist at the same time. What happens if the candidate does not take the pulse at the radial artery, as stated in step 2? If the candidate takes the pulse anywhere other than the radial artery, the evaluator will score no on steps 2 and 6, regardless of whether or not a different pulse location provided the same measurement as recorded by the evaluator who was measuring the radial pulse. This skill is testing whether the candidate knows how to correctly locate the radial pulse and if they're able to obtain a pulse rate at the radial artery location. Remember to verbalize wash hands, step 5, before recording the pulse on the measurement sheet. How should the candidate count respirations? Other than count for 1 full minute, the skill steps do not tell us how the candidate should count the respirations. It is very important to note that for all skills, the only actions the evaluator can score are the actions written within the skill steps. The candidate can simply watch the rise and fall of the client's chest, or maybe they can ask the client to cross their arms over the chest to make seeing the rise and fall easier. Or maybe the candidate places their hand on the client's chest or shoulder. All of these methods are acceptable, and none of them have any impact on scoring because the skill steps do not score how the candidate counts the respirations, other than they must count for 1 full minute. This is different from the pulse skill, where the skill steps require the candidate get the pulse by palpating the radial pulse. Remember, the evaluator will instruct the candidate to tell the evaluator when the candidate begins counting and when the candidate has completed counting. The PPE skill is set up as a station. This means all the supplies are in one place. The candidate does not need to gather the supplies for the skill. Most skills require the candidate gather the supplies required to complete the skill. Some skills, like PPE, are already set up by the evaluator. As an example, a few other skills or set up stations include denture care and hand hygiene. For PPE, a candidate will be provided with a gown and gloves and a receptacle for the PPE. Remember, once the PPE is removed, even if it's a cloth PPE gown, it should always go into the receptacle provided at the station. The receptacle is usually a trash can or linen basket designated at the PPE station as the red bag trash. Most candidates that fail this skill do so because they either remove the gloves or the gown incorrectly and end up contaminating themselves. Please note the cuff under the glove is considered clean. Proper gloving and degloving is very important in this skill and also in other multiple skills within the exam. So candidates must be able to perform glove removal correctly. When removing the gown, the candidate should move slowly and deliberately, making sure they do not touch the outside of the gown to their body, clothing, or the floor. This is also important in skills where the candidate is picking up dirty linens, such as in bed bath skill, pericare skill, and others. The dress as client skill does not tell us the position of the client, and as a result, the position of the client is not scored. The candidate could have the client lying in the bed, sitting on the side of the bed, or maybe sitting in a chair. All are acceptable. Candidates should practice this skill focusing on the right arm versus the left arm. When I am facing you, my right is your left and vice versa. Knowing that the gown gets removed from the left unaffected side first, but when placing the shirt, you put the affected arm in first. Remember to dispose of the gown removed from the client and place it into the soiled linen hamper before dressing the client. Always pay attention to the order words such as before, after, and while. Clothing in place means the shirt is on the client. It is not backwards. If there are buttons or snaps, the candidate may connect them, but this is not scored. Important reminder, step 3. Candidate should hold up at least 2 shirts and ask the client which shirt they would like to wear, and then use the shirt the client picked out to dress the client. Surprisingly, this is one of the most missed steps typically seen in this skill. The feeding skill provides the candidate with the most verbal interaction with the client. The skill has multiple steps where the candidate is asking the client a question and telling the client some information. This begins in step 2. Step 2 asks the client to state their name. The candidate asks the client which food they want to eat. The candidate tells the client what food and beverage is on the plate. The candidate tells the client the contents of each spoonful. Candidates must pay attention to the asks and tells in the skill steps and perform them as written. The skill also has some specific steps directing the candidate on the position of the patient. Step 3. The client must be seated upright 75 to 90 degrees. Most candidates perform this skill with the client in bed. It is important that the client be sitting upright at 75 to 90 degrees. The evaluator is scoring the step based on the client position, not the head of the bed. At the end of the feeding, step 14, the client should be left in the upright position. Don't forget step 5. The candidate cleans the client's hands. And step 12, candidate cleans client's mouth and hands. Do not hand the cleaning implement to the client to tell them to clean themselves. The step requires the candidate clean the client's hands and mouth. Step 6 requires the candidate sit in a chair. Do not sit on the client bed. Step 13 remove the food tray once completed, and the evaluator will tell you where to place it. The bed bath skill, like pericare and catheter care skill, require the candidate to put water into a basin and to use soap, washcloths, and towels to perform the skill. Additionally, there are steps that specify the client not be overexposed. Please note step 3. Removes gown and places directly into soiled linen container. The candidate should remove the gown immediately. Place it into the soiled linen container. Do not drop it on the floor or put it on the bed. One of the most missed steps we see in this skill is related to step 3. Step 13, putting on the clean gown. When candidates do not remove the gown at the beginning of the skill, they often forget about it and never put the clean gown on the client. Step 3 also requires the client's chest and lower body remain covered to avoid overexposure. The candidate should use one basin filled with water to wash and to rinse. This is referred to as bathwater concept. It does not require the candidate to use a basin for washing and a separate basin for rinsing. They may use one basin. Note, there is no soap used on the face, and a different area of the washcloth must be used for each swipe, inner to outer, for the eyes. Wash the entire face. This includes the nose. Soap should be placed on the wet washcloth in step 9. Note step 10, washing fingernails, is simply going over each fingernail with a washcloth. We are not doing full nail care in this skill. Do not pick up the dirty linens without having the gloves on. Candidates will be marked no on step 18 if they contaminate themselves by touching the dirty linen or supplies without wearing gloves. And be sure to remove the gloves in the correct way, just as you would do for the PPE skill. Some states test skill 12 electronic BP, and other states test skill 23 manual BP. These are not interchangeable and are set by your nurse aid state agency as a required skill. Check in your state nurse aid candidate handbook for the correct skill in your state. In both skill 12 and 23, candidates must palpate the brachial artery, and they must put the cuff on correctly with the sensor arrow over the artery. The client's palm must be up and at heart level. Step 12, make sure you verbalize wash hands before recording. If the candidate performs the skill incorrectly, for example, with the cuff upside down, the evaluator will wait until the candidate writes down their measurement and states skill complete, and then the evaluator will stop the timer and take the BP using the same device but correctly. The RN evaluator is required to document the correct BP. The evaluator must document why they need to take the BP again and compare it to the candidate's reading to determine whether the candidate gets a yes or no on the final bolded step. Measures and records urinary output is set up as a station. This means the candidate does not need to gather the supplies. The evaluator will set the supplies up on a counter or table close to a sink. The fake urine will already be in the bedpan. The gloves, measuring container, commode or toilet, and paper towels will be in the same area. Step 3 requires that the bedpan be rinsed and the rinse poured into the toilet or commode, not into the sink. I mention this because this is a common mistake candidates make in the skill. This is a measurement skill, so the candidate is required to wash hands and record their measurement on the measurement sheet. Although the candidate does not need to write milliliters or cc's, the measurement number must be in milliliters or cc's and not in ounces. Skill 14, measures weight, require that the candidate walk the client to a scale to get a weight measurement. Step 2, make certain that the client is wearing shoes before walking to the scale. The client is wearing shoes when being weighed. Note steps 4 and 5. which require the candidate to ask the client something, to step onto the center of the scale, and to step off of the scale. The candidate must ask. In step 6, wash hands before recording. The final step is the boldest step, and the weight recorded must be the correct weight. The correct weight is determined by documenting what is seen on the scale. As directed on the measurement sheet, the candidate must write the number and the unit of measurement used, whether it was pounds or kilograms. Performance modified range of motion for knee and ankle is similar to performance modified range of motion for one shoulder. Both skills require the candidate interact with the live client and perform the skill with an understanding of how to move the client's body in a safe, pain-free manner by supporting the joints and moving the limb through a predetermined range of motion, focusing on the body part listed. Step 3 requires that the client be supine and that the candidate instruct the client to let them know if they experience any pain during the exercise. Steps 4 and 5 are bolded critical element steps and provide important instruction on how to perform the exercise. Step 4. Note the leg is supported under the joints at the knee and ankle. The motion that is required is of the knee. This is not an exercise of the hip. The candidate should support and lift the leg just off of the bed. Bend the knee so that the heel comes toward the buttocks, and then replace the straightened leg to the bed. Do not drag the client's heel on the bed. Support the leg as it is being bent by holding under the knee and the ankle. For ankle support, candidate's hand can be on the heel or under the ankle or under both the heel and the ankle. Do this 3 times, watching and listening for any signs of pain from the client. Move slowly and mindfully. Step 5 requires plantar and dorsiflexion of the foot. Support the foot and ankle close to the bed. Remember, hover just above the bed. Do not rub the heel on the bed. The candidate's hand should be on the heel or under the ankle or both. All these methods count as supporting the ankle. Candidate hand moving foot counts as supporting the foot. Do this 3 times. And as before, watch the client for signs of pain or discomfort. Or better yet, ask the client how they are feeling throughout the skill. Note, asking before you begin the exercise and or during all count for a yes for this element of step 3. As mentioned, skill 16 performs modified range of motion for one shoulder is similar to skill 15 performs modified range of motion for a knee and ankle. Both skills require the candidate interact with the live client and perform the skill with an understanding of how to move the client's body in a safe, pain-free manner by supporting the joints and moving the limb through a predetermined range of motion, focusing on the body part listed. Step 3 requires that the candidate instruct the client to let them know if they experience any pain during the exercise. The client's position is not specified and as a result is not scored. Although most candidates perform this skill with the client supine in the bed, the client could also be sitting on the side of the bed or in a chair. The recommendation is to perform the skill supine in the bed, as this will be the position the client will be in at the beginning of the skill. And for most candidates, it is the easiest client position to use for this skill. Steps 4 and 5 are bolded critical element steps and provide important instruction on how to perform the exercise. Step 4 requires the arm be supported at the elbow and at the wrist. The candidate should hold under each joint. Step 4 requires the candidate demonstrate flexion and extension of the arm, raising the straight arm from the side position up toward the head to ear level 3 times, continually monitoring for signs of pain and discomfort. Step 5 requires the arm be abducted and adducted from the side position. The abducted movement should bring the arm up toward the shoulder or out toward the shoulder level. The movement is to be performed 3 times while monitoring for pain and discomfort. Positions on side. This is a skill that requires the candidate to demonstrate that they understand how to position a client on their side in a way that reduces pressure points and maintains comfort. There are several steps requiring the candidate to touch the client and to make adjustments. The bed position is also important. See step 3. Before churning, lowers head of bed. Additionally, this is the only skill which requires the use of a side rail. Step 4. Raises side rail on side to which body will be turned. Note that this is the only mention of the side rail, and as a result is the only step that can be scored as concerns the side rail. Whether the candidate lowers a side rail later on in the skill or keeps it raised once the candidate is positioned is not scored, and as a result for testing is not considered in the scoring. The patient must be touched in step 5. Candidate assists client, patient, to slowly roll onto side toward raised side rail. The step does not tell us how the candidate must touch the client. Note, whenever you see assist in reference to the candidate assisting the client to roll over, sit up, stand up, etc., this always means to touch. How the candidate assists or which touch is not defined here, so long as the candidate touches the client to assist them to roll onto their side. That is all that is needed to meet the aspect of the step. The recommendation is to use best practice on assisting a client to roll to their side. Step 5 must be performed before steps 6, 7, 8, 9, and 10. The candidate must assist the client to roll onto their side toward the raised side rail and then use the pillows to complete the positioning and make the required adjustments. The candidate must adjust the pillow under the head to show the evaluator they've considered the pillow's position. The candidate must adjust the arm and shoulder so that the arm is not under the body and to show the evaluator they've considered the position of the arm and shoulder. Even if the arm is not under the body, touch the arm and or shoulder to show that you know this is important. The candidate must position the pillows as described in steps 8, 9, and 10. As with most skills, the final steps require a bed low position and signal device within reach. Provides catheter care for female. This skill is performed on a mannequin and requires use of real water, soap and towels, and washcloths. All skills where water is used on a client, whether it be a live client or the mannequin, have this step. Before washing, checks water temperature for safety and comfort and asks client to verify comfort of water. The candidate can accomplish testing the water at the sink while running the water or by putting their hand or finger in the basin. When asking a mannequin, it is acceptable for the candidate to ask the mannequin if the water is okay. They do not have to put the mannequin hand in the basin. The evaluator will speak for the mannequin. Note the candidate can check the water while wearing gloves. The candidate will be marked yes. In step 5, the candidate must be sure to place a linen protector, this might be a towel, under the client's peri area, including the buttocks, in order to be scored yes. Most candidates accomplish this by rolling the mannequin onto its side and sliding the linen protector under the bottom. Once the candidate has the mannequin rolled onto the side, the evaluator will place a hand on the mannequin's hip to keep it from rolling back before the client is ready. Note step 6, where exposure is defined. The mannequin is wearing a patient gown that will cover the chest. The candidate should use the bed sheet to cover the feet, lower legs, and knees. So the window of exposure is above the knees to the hips, so that the client is covered by the candidate, and the candidate can work on the catheter area and the evaluator can see the skill performed. Apply the soap to the wet washcloth. Make sure the catheter is held at the meatus with one hand while using the other hand to hold the wet soapy washcloth starting from the meatus and cleaning at least 4 inches along the catheter. Use a different area of the washcloth for each stroke. Speaking of washcloths, how many are required in this skill? Step 7, soapy washcloth. That's our first washcloth. Using a different area of the washcloth for each stroke in step 8. Step 9 is a second washcloth with no soap, as it is used to rinse the catheter. Step 10 can be performed with a dry washcloth or towel. The steps do not specify how many strokes are needed to clean the catheter, but the candidate must demonstrate that they are cleaning the entire circumference of the catheter. Step 11 empties, rinses, and dries the basin. The step does not say where to empty the basin, so the commode toilet or the sink are acceptable. Make sure dirty linen is disposed of correctly while wearing gloves, and take the gloves off just as you would for the PPE skill. One of the first things we notice with the foot care skill is the position of the client is not defined, aside from what we see in step 4. Basin is in a comfortable position for the client and on a protective barrier. The client may be seated in the bed, at the side of the bed, or even in a chair. I do not recommend the chair option because it takes time and the patient is already in the bed. Note step 6. Client's bare foot is placed into the water. Step 6 leads to step 8, where the candidate lifts the patient's foot from the water and washes the foot. If the foot is not placed into the water in step 6, then step 8 cannot be completed correctly. In our water skills, we typically see a step 7, apply soap to wet washcloth. Candidates should not pour soap into the basin. They must apply the soap to the wet washcloth. Note mention of the toes in steps 8, 9, and 11. Candidate must wash and rinse between the toes, but not put lotion between the toes. To wash, rinse, and dry the foot and between the toes, the candidate must demonstrate they are washing, rinsing, and drying not just the foot, but also between the toes. All methods include separating the toes and demonstrating washing, rinsing, and drying between the toes. The foot is supported throughout the procedure as described in step 12, supports foot and ankle. Skill does not tell us how to support the foot and ankle, but we know from best practice that supporting under the joint is best. This would mean the candidate would hold under the heel and ankle with one hand and wash, rinse, and dry with the other hand. Do not let the foot dangle. Mouth care contains multiple steps that provide specific instruction. Client must be seated upright 75 to 90 degrees. Note, this is also a requirement in the feeding skill. Cloth towel is placed across the chest. Note in the feeding skill, there is no such requirement. The toothbrush must be moistened before the toothpaste is applied to the brush. Step 8, the bolded step, requires the candidate clean the tongue and all surfaces of the teeth. Candidates can easily do this by segmenting the areas of the mouth. For example, all sides of the top left teeth, bottom left teeth, and move to the right side and to the front in the same way. Do not forget to brush the tongue. Step 9 reminds the candidate to use clean technique with placement of the toothbrush. Do not place the toothbrush directly onto the sink. Use a barrier. The toothbrush can also be placed into the emesis basin. The candidate must wipe the client's mouth and remove the towel from across the chest in step 11. Remember, dispose of used linen into the soiled linen container. Do not remove the gloves until all used and dirty linen is in the dirty linen container, as we read in step 13. The toothbrush is rinsed, emesis basin is emptied, rinsed, and dried. The skill step does not say where to empty the basin, but the sink makes sense. Provides pericare for a female. Please note that for this skill, I have noted where a clean, unused, or new washcloth will be required in the skill with the letters WC next to the step. Pericare for female is a water skill, and during the water skills, the candidate is allowed to put water into a single basin. The candidate should use soap and washcloths and towels to perform the skill. Step 3 is the most missed step in the skill. Candidates must check the water for safety and comfort and ask the client mannequin to verify. The candidate does not need to place the mannequin hand in the water, and the evaluator will speak for the mannequin. Additionally, there are steps that specify that the client not be overexposed. Please note step 6 exposes peri area only exposing between the hips and the knees. The feet, legs, and up to the knees should be covered in a top sheet, and the client mannequin's chest is already covered by the gown. The candidate should, as mentioned, use one basin filled with water to wash and to rinse. This is referred to as bathwater concept, which does not require the candidate to use a separate basin for washing and rinsing. Note, soap should be placed on the wet washcloth in step 7. The bolded critical element steps are 8 and 9. Both steps require the candidate wash from the front to the back. The washcloth in step 7 is used in step 8. Step 8, we use a clean area of this washcloth for each stroke. Step 9 requires a new clean washcloth used to rinse, while using a clean area of the same washcloth for each stroke. Step 10 requires a dry washcloth or towel. And step 11 is one of the most missed steps because the candidate completely forgets to turn the client to the side and repeat the procedure on the backside. The washcloth used in step 11 can be one of the already used washcloths. Just use a clean area for each stroke and definitely use soap to wash. Step 12 is a new clean washcloth to rinse, using a clean area for each stroke. And step 13 requires a dry towel or a washcloth. So if we count up all the washcloths for the skill, the minimum number of washcloths needed if you use 1 to dry in steps 10 and 1 to dry in step 13 is 5. If the candidate uses a dry towel for the drying steps, then only 3 washcloths are required. Candidates should always wear gloves when touching dirty used linen supplies. The steps require that linens not touch candidate clothing. Step 18 is often missed. And be sure to remove the gloves in the correct way, just as you would do in your PPE skill. The wheelchair skill, like all of the skills involving the client standing, requires some key steps to be completed. For example, put shoes on the client. Note these are the candidate volunteer's own shoes. The bed must be at a safe level so that the client can sit on the side of the bed with feet flat on the floor. The candidate should always assist the client to sit on the side of the bed. Note assist means to touch the client, to assist them to sit up. Feet flat on the floor. Candidate must make sure that before they actively stand the client up, the client has both feet planted on the floor. Knee to knee and or toe to toe, which means the candidate's knee or knees are touching the client, knee or knees, and or toe of the candidate's shoe is touching the toe of the client's shoe to maintain stability. You see the same step requirements in some of our other skills that require the candidate to be stood up. Note, in skill 3, the steps that start with the order word before. Steps 3 through 11 are all completed before the client is assisted to stand up. Take a look at steps 3 through 5. All of these steps tell the candidate how to set up the wheelchair before they even move the client. It's positioned alongside of the bed, at head of bed, facing foot, or foot of bed facing head. Footrests removed or folded up. Wheels on wheelchair locked. Pay attention to the words such as securely, prearranged signal, stability, assists. Note the hand position on the gait belt. Step 13, upward grasp. This skill provides very detailed instruction for the candidate to follow, all of which are focused on safety of the client. Note in step 14, the client should be assisted to stand and then to turn and stand with the back of their legs against the wheelchair. The client is then lowered into the wheelchair with hips touching the back of the wheelchair. Remove the gait belt, provide the signal device, and then the candidate will wash hands. Whether the wheelchair remains locked at the end of the skill is not scored. The candidate will end the skill with the client seated in the wheelchair with their feet on the footrests. Some states test Skill 23 manual blood pressure. Other states test Skill 12 electronic blood pressure. These are not interchangeable and are set by your nurse aid state agency as a required skill. Check in your state Nurse Aid Canada handbook for the correct skill in your state. In Skills 23 and Skill 12, candidates must palpate the brachial artery, and they must put the cuff on correctly with the sensor arrow over the artery. The client's palm must be up. Step 7 requires the cuff be inflated between 160 and 180. If beat heard immediately upon cuff deflation, completely deflate the cuff. Reinflate cuff to no more than 200. If the candidate inflates the cuff above 200, the evaluator will call a safety stop. A safety stop means that the candidate is not allowed to continue the manual blood pressure skill and must stop the blood pressure skill and steps and move on to the next skill. If the candidate reports inability to hear the blood pressure, maybe they deflated too quickly, or simply they do not know how to take blood pressure, the evaluator will instruct the candidate to reinflate and try again. The candidate can retake the blood pressure up to 2 times on each arm. After retaking, if the evaluator can hear the sounds, but the candidate cannot, the candidate must record a measurement. If neither the candidate nor the evaluator can hear sounds, a new client will be selected. If the candidate does not take the blood pressure correctly, for example, if after repeating does not put stethoscope in the ears or the evaluator does not hear the blood pressure, after the candidate completes the skill, evaluator must stop the time and retake the blood pressure to get the correct reading. The RN evaluator is required to document the correct blood pressure. The evaluator must document why they need to take blood pressure again and compare it to the candidate's reading to determine whether the candidate gets a yes or a no on the final bolded step. That concludes our 2021 review of the skills evaluation. If you are a training program and have specific questions about the skills and/or skill steps, you can reach out to NA training instructors at getcredentialed.com for assistance. If you are interested in becoming a test site, please email natestsiteapplications@getcredentialed.com. If you are already a test site and have questions concerning equipment and general site responsibilities, please email facilitysupport@getcredentialed.com. Thank you.